Hello, I'm Samantha, the vet tech on board here. Nice to meet you too. So we've taken Bambi into the back, and we're going to take really good care of her. I just have a few questions to get the overall picture of her health.
Sure, whatever you need.
Perfect. So we're just going to confirm some basic information. I have here that Bambi is a 6-year-old spayed female Great Dane.
That's right.
Weighing 45 kilograms.
Yep.
Super. So is Bambi on any other medications or any health concerns that you have?
No, she just had her vaccines and she's a healthy dog.
Perfect. So we also need to decide what you want us to do in providing what medical care you want us to do, if we want to stop, if there's any issues in the worst case scenario.
Okay.
So far we've noted on her left side that there is some air and she's slightly bloated. Her mucous membranes are pale. Her heart rate is rapid and weak, as well as the veterinarian does believe that it might be bloat. This is where the stomach becomes enlarged. It can fill with air or food. And sometimes the stomach will actually twist upon itself and then cut off the vena cava, which is the blood supply back to the heart. Okay. This involves aggressive treatment and surgery. We need you to actually sign this permission form telling us that it's okay for us to perform these procedures.
Okay, do whatever you need to. I just don't want to lose Bambi. She's my best friend.
I completely understand, thank you. We also need to know what signs Bambi first started showing.
Okay, well, this morning she had breakfast and then I took her to the park like usual, and she was running around playing with all the other dogs and she was totally fine. And then when we got home, that's when I noticed she was more lethargic, and when she was laying down, her stomach looked a lot more bloated. And then she started heaving, and I thought she was trying to vomit, but nothing was coming up. So I wasn't sure. I thought maybe she was just sick. And then I noticed she was also limping, like she was in pain.
Yeah, well, this is very serious if it is bloat. So far, we brought her to the back. She's on shock fluids. We've given her oxygen, as well as taken some blood work for some tests to get a clearer picture. She's on an ECG machine, so we're going to stabilize her, as well as take some fecal samples and take some x-rays to kind of narrow down what we're dealing with.
Okay, when will the x-rays be ready?
If you'd want, I can go check in the back to ease your mind, and is that okay?
I would appreciate that.
Absolutely. I'll be right back. Okay, so Dr. Lincoln has taken a look at the radiographs, and it does appear to be bloat. So there is air shown on the radiographs. Therefore, we're going to actually place a large bore catheter into her stomach, and this will relieve any pain, immediate pressure and pain, and to relieve.
I just hope everything goes okay. I hate that this is my fault and I can't do anything to help her.
First of all, this isn't your fault. You brought Bambi into the clinic as soon as you noticed anything wrong, which is the best thing you could have done for her.
Thank you. I just can't lose her.
So we're doing everything that we can possibly do to save Bambi.
Okay, what else do you have to do?
So what we're going to do is we're going to stabilize her with all the things that I've told her before we can take her into surgery. So what we're going to do is we're going to perform a gastropexy, which is going to right the stomach. We're going to flip it back and then into its original position, and then we're going to suture it to the abdomen wall to prevent further twisting in the future. Worst case scenario, there can be gastric necrosis, which is death of the cells in the stomach. There can also be perforation, which is a hole in the stomach, and this can happen up to a week after surgery, especially if we have to remove a portion of the stomach if it's dead.
So this can happen again? I thought you said that suturing the stomach will prevent this from happening.
So yes, it will prevent the stomach from twisting again because it is sutured. However, bloat can occur again. So meaning the stomach can fill with air or food, and there may be some other complications associated with this, which is poor circulation leading to shock, which it can result in anemia or hypoproteinemia, which is low protein in the blood. We also may need to do a blood transfusion on Bambi. There's some cardiac arrhythmias that are possible in acute cases of bloat. We will monitor with an ECG and her heart arrhythmias for the next 72 hours and get an antiarrhythmic on board to control the situation. Do you have any other questions or concerns?
I think you've answered everything, but do you think she will be okay?
So I can't say for sure. However, I will give you a call right after surgery and update you of her progress.
Okay, I would appreciate that so much. Thank you.
Oh, absolutely. It was nice to meet you.
Nice meeting you too.